Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you experts and information about nutrition, prevention, integrative medicine approaches to help the individual, society, and the world. And so today I've talked in the past about a topic of Alzheimer's disease and dementia and five simple things that you should do as your basis. Uh, for example, exercise daily helps brain function. uh, no sugar diet, keep your insulin levels low, avoid prediabetes, helps brain function. Sleep, 7 to 8 hours of sleep a night helps brain function. Good stress, good challenge, such as learning a new dance step or reading, learning something new that makes your mind excited about doing it, but you're still challenged. And then five, avoiding overwhelming stress. But those are the basics, and you try and get everybody to do those all lifelong, but especially as you get on in age, and because they're the cheapest ways to improve. Now, if you get somebody that already has cognitive decline or is even hinting at it, then you want to be more aggressive. And I actually think you should be more aggressive on everybody that gets over the age of 50. So I want to share a case study that was a point that I try and make all the time to patients, especially couples when they're worried about one of the partners having um, some cognitive issues, is that you got to start now and you got to be aggressive and you have to look at every spoke on the wheel that can be imbalanced that could affect health or affect brain function and try and correct it, because it's not usually one thing. If you're going to improve cognitive decline and dementia, you have to do those five lifestyle factors very, very well. But you might have to tweak a few things. And if you don't, if people wait too long, if the couples wait too long, and this is heartbreaking for me because I've seen it happen more often than I would like to say, they come in and the one partner can participate, but they don't do as much as they can in that short period of time. And in 3, 6 months, they can't participate anymore. And then all the burden goes on to the caretaker, the partner, and they can't do it. And the person goes into a memory care center, and then it's just high level care, but it's not going to improve your memory. So I had a patient where that happened, but I want to show you what we found out, but then I couldn't do anything about it because the patient had already moved to a facility, and the partner just couldn't deal with it anymore because the decline got so much. So we were there too little, too late. So 80-year-old gentleman, 8 years ago, might have started noticing some cognitive decline. 4 years ago, was seen at a medical center, said he had some definite cognitive decline, license taken away, had a history of being a professional uh, in the psychology field, top at what he did at his institution, was a leader there, and but did have some habits of alcohol consumption, sweet consumption that I know. Uh, and so anyway, we did laboratory work on this 80-year-old, and by the time that I got it all back, because it all trickles back over a 3 to 4 week period, he had already been moved to a facility, and you can't do it there. But I wanted to go over some of the imbalances that we found out. So in this gentleman with cognitive decline, I don't think this, I do fasting insulins on everybody. And even though the wife said that he was fasting, I'm not convinced that he was, because a 93 insulin level is outrageous. The normal range is 0 to 23 or 24. And you want someone with, well, healthy and definitely with cognitive issues to be below 5. So I'm not sure if that was correct. Maybe snuck a little sweets before I came in. His A1C was good at 5.2. So, but the insulin resistance is key. That is probably one of the most important tests you can do. And again, you want to get it to below 5, and you can either do that by a mild ketogenic diet. You can do it by not eating for 10 to 12 hours a day, and you can do it by a whole food diet if you're not eating any processed carbohydrates and getting exercise. But some people go to a more ketogenic diet because that'll drop it quickly. So his B12 level is something modifiable. So usually in the 250 range is deficient, but a lot of practitioners in this medicine, if you're below 500, they think that that's a low normal and you can improve function. And I would agree. And so his was 399. So that's something we would have given him some maybe methylcobalamin, uh, 1,000 micrograms a day orally, something to boost him up, or a few B vitamin injections. His homocysteine was 11.2. That's a risk factor for cardiovascular, stroke, and Alzheimer's. 11.2, we like it definitely below 10 and close to 8. So B6, B12, folic acid are supplements that help lower that. If kidney function was fine, I'm looking at his chart here, and his kidney function was fine. If kidney function is elevated, it's going to make the homocysteine level go up no matter what you give it. Next was his vitamin D level. This is the simplest one. This one breaks my heart because it can be normal on everybody. And his was 28. It should be the the deficient level that most traditional doctors look for is 30 um, nanograms per ml. But in our business, most people will shoot for 50 to 75. And that's with usually 5,000 to 10,000 IU a day. So he was deficient there. That affects everything. Then we came to his testosterone levels, and testosterone really can help with cognitive function. And it was low normal. He was normal, but it was his free testosterone was just in the normal range. So, for example, the range is 6 to 18, and he's 7. He's at the low end of normal. So that would be worth a therapeutic trial of testosterone. And his PSA was reasonable at 2.2. And with an exam, then there would be no problem giving him a testosterone trial. And I would give 100 milligrams a week IM for 4 weeks and see how he responds. Now, again, we've got 3 or 4 spokes on the wheel already that could be tightened better. The next was his thyroid. So, traditionally, the TSH below, well, his TSH was 4.3. So that's right at the high end of normal. Many people in integrative medicine want to bring that 2 or below. So his free T3 was 2.7. So that is a low normal. So that's someone who would, in my world, especially in his situation, would give a therapeutic trial of a natural thyroid, which has a combination of T3 and T4. And that can make a big difference in cognition. So again, we have a little something that's in low normal range, but could be modified. And that's the way this medicine works. So now we've tightened 4 or 5 spokes on the wheel. His vitamin E was grossly deficient, was frankly deficient, so was vitamin C. And I never see that usually. Vitamin E was at 6.2, and that's a very low end of normal. So vitamin E helps protect fatty membranes, brain could be, and vitamin C is important in everything from adrenal gland function to antioxidant to detoxification, enhancing immune function. So we have C and E. His blood count was fine. His iron stores were fine. He had a little elevation of liver enzymes, and he wasn't overweight. So my guess is he had a little fatty liver, and that might have been due from alcohol and sugar content. So that was, and I didn't do all the testing that I would normally do. So in someone with cognitive decline like that, you're really trying to pull out the stops. You do a heavy metal screen, but we couldn't do that because we couldn't get them to sit down. We would possibly do urinary mycotoxins. Um, but again, that's difficult. We would have done the SIRS markers, chronic inflammatory response syndrome markers for mold sensitivity that can be triggered by that. I didn't get those done. We did. Excuse me. I did part of those. The TGF beta was very elevated. I mean, sky high, and the MSH, melanocyte stimulating hormone, and VIP, vasoactive intestinal peptide were low. So those are only 3 of the 10 markers that the Shoemaker protocol notes. But again, the question is, let's say we found those, then they got to look at their home for mold, and there's a way to do that. So it's a lot. So those are just some of the things, probably 7 or 8 parameters. And I know he was eating a very high sugar diet. So if we could have changed the diet to a whole food diet, at least with no added processed foods, or to a mildly ketogenic diet, that might have done the trick. To have 6, 7, 8 things put together, and then you have to sustain those for 3 to 6 months, see if they got in, and then see if the patient starts to improve. That's different than the 2 medicines that they usually give um, for Alzheimer's, and there is no single medicine. So those things in conjunction with the aggressive exercise program, good sleep program, um, And the diet, the low sugar diet, and a no sugar diet or mildly ketogenic diet, challenging some kind of good brain challenge, all that put together, if you can sustain that for months, you can do what Dr. Bredesen shares in his original book. You can help fill some of the holes in the roof of the 36 or 37 holes in the roof. You can improve. So the point I'm sharing here, and the reason I'm doing it is, if you have, like I do the MOCA test here, it's a screening for people. Um, and if you have mild cognitive decline, you can function. And a lot of partners do, they function, but they're learning each other's weaknesses and strength, or the partner that has the memory issue. But if you don't change, all of a sudden when you get to a point, the partner has to do everything, and all this, you can't do anything about it. It's hard enough to do when the person's present. Okay, ideally you put people in a facility that actually does these kind of things and measures these values, and changes the diet, does a mildly ketogenic diet, and does um, you know, IVs and hormone therapy. I mean, that would be the perfect institution. Uh, um, but those aren't easily accessible. So anyway, my name's Kirk Hamilton. This is the Staying Healthy Today show. It's not to bring you down. It's an urge that there is things you can do, but you need to do it quickly. And I'll put the link to Apollo Health. It's a excellent website that has information on this kind of approach by Dr. Bredesen. But whatever you do for memory care or memory, don't delay on it. Do it early. Do the basics. Aggressive exercise program. I don't think I've ever seen someone who's really a super exerciser when they're older have dementia. I'm not saying it doesn't exist, but it's rare. Got to keep the sugar out of the diet. Got to eat whole foods first, just like you're in a farmer's market. And then some people have to do mildly ketogenic diets. Sleep, my bad. Okay, working at it. Good brain challenge, and avoid overwhelming stress. So visit my website or my Substack. It's stayinghealthytoday.substack.com. And we'll talk to you soon. You have a great day.